Hello everyone, welcome back to my YouTube channel. If you're new here, please kindly subscribe. Click on the notification bell so that you always get notified when I post a new video. So today we are going to talk about getting chin fillers. So stay tuned and watch the video to the end.
Fillers don't dissolve over time. That is a lie that they sold you. Fillers migrate and expand over time. That's why now you have the pillow face and the puff face and the whatever. This is a fact.
Now that I've gotten rid of my facial tension, my chin is smoother, a lot less dimpled when I smile, and has a bit more projection. The first technique is going to be the chin pincher. Use oil or moisturizer and medium pressure here. Typically the whole lower mouth has tension if the chin does, so the lip pinch helps address this. With the lip pinch, you'll feel inside your mouth how this connects to the chin area. You'll feel a kind of stretch or release right where your gums connect to the inner mouth. It really feels good. Brow tension typically contributes to chin tension as well, so we release that here with the front part of the knuckle. Finish off with an overall massage to really signal to your body that we are letting go of tension from this area. Let me know how it goes.
Thinking about getting chin fillers? Before you book that appointment, there are a few things you need to know. You need to know so many things before you go ahead booking that appointment for your chin fillers. Watch this video to the end and you will learn.
Can I tell you one thing about my chin filler that really pisses me off? Because I feel like a lot of people get it for the same reasons, right? So you should probably know this if you're thinking about it. Reason one, obviously to balance your profile out. A lot of us get it because our chin's like set back like this and it makes us look like we're just not balanced and our double chin's exaggerated. So we get it filled up to bring it further out here to be more in line with our nose, right? And then from the front, if you get chin filler here, it will, elongate your face and also cover up your double chin that might have been peeking through the bottom when your chin was half this size. Do you know what I mean? So that all works perfectly. I've been getting it since I was 21. I'm 26 now. I'm still happy that I have it, but there's just one thing that really annoys me. Oh, I just spat everywhere. Really annoys me about it. So look carefully, okay, and don't judge because this is quite an insecurity. From the side, if I try really hard, you can't see that I have a little pocket of double chin fat here, but I do if I relax myself. You can kind of see it, right? But now that I've got chin filler, it looks quite weird because my double chin starts from back here. It doesn't start at the front of my chin like it would on a normal human, because in actual fact, this isn't my chin, this isn't a part of my jaw, this is fake. See, it literally wobbles. So obviously my double chin starts where my real chin starts, which is back here. So it kind of looks really fucking weird. Do you know what I mean? Like I said to my boyfriend, I was like, do you ever notice it? And I like pointed it out to him, like, I was like, do you think that's weird? It starts back here because my real chin's back here. And he was like, yeah, to be honest, I did notice that before. So that is the downside to chin filler, but I still think all in all, I prefer it. So, but yeah, that is really annoying.
This is me before getting my double chin dissolved. This is my side profile. This is me immediately after. A little bit of swelling. This is me 12 hours after getting my double chin dissolved. This is my side profile. This is me 1 day after getting my double chin dissolved. Side profile check. This is me 2 days after getting my double chin dissolved. Side profile check. This is me 3 days after getting my double chin dissolved. This is the side profile, and this is a double chin check. This is me 4 days after getting my double chin dissolved. Side profile check, and double chin check. This is me 5 days after getting my double chin dissolved. This is the side profile, and this is a double chin check. This is me 6 days after getting my double chin dissolved. Side profile check, double chin check. It's insane. Okay, this is me exactly 1 week after getting my double chin dissolved. And you guys, side profile check, and double chin check. That's insane. So you see the final results 4 to 6 weeks after the procedure, but honestly after 1 week I already feel so much more snatched. Keep you guys updated.
While chin fillers can enhance your profile and improve facial balance, they are still medical procedures, not just beauty treatment. Choosing an unqualified injector or prioritizing low prices over safety can lead to disappointment.
Sorry, I'm gonna say this once. Fillers are to make 50-year-olds look 40. Fillers are to make 40-year-olds look 30. Fillers are to make 60-year-olds look 50. If you are in your 20s or teens putting fillers in, they are going to make you look 30 or 40 or 50, because it's the reverse effect. It's to make you look younger if you have a bunch of loose skin, but you don't have a bunch of loose skin, so now you look older. Fillers are to fill what has been lost. If nothing has been lost and you just want to fill, you will look the reversed effect. Stop getting fillers in your 20s. And any good dermatologist saying that you need to preemptively get fillers is a bad dermatologist, because my dermatologist told me that I had let me take a filter. My dermatologist told me I had no fine lines, no reason to get fillers.
We have a lot of potential risks while doing chin fillers. So there are swelling and bruising, infection, lumps or uneven results, and filler migration, allergic reaction, and so many.
Basically just to like make your skin like not have a double chin. But my chin, like that I don't really hate, but it's just my chin filler. I don't know, guys. If you're thinking of getting anything on your face, don't do it. Yeah, they're called PDO threads. PDO threads. It's so scary. They should literally went inside of my face and like sucked it back up. So it's just like, it's not that noticeable either. Okay, don't look at my flat head. Maybe I could get something from, should I get filler right here? But look, like, oh my god, I'm trying to see. I want to say like right here. I don't think I told you guys before. Why did you do that? Because head BBL. Should I get a head BBL? No more filler. I know, guys, I hate the chin filler. It doesn't look bad, but when I smile, like, I'm gonna look like, who's that one guy with the long chin? Look.
I can't believe I'm about to show this picture of myself, but I am trying to prove a point that Botox and filler does not make you look older if it's done correctly. Alright, here goes nothing, whatever. This was me 7 years ago. I honestly look so much older in this photo, and this was 7 years ago, so I was 23 and I'm 30 right now. I have no makeup on here and I have no makeup on right now. Now, just to preface this whole story, I am an aesthetic nurse practitioner and I specialize in facial balancing with natural results. And I am so sick and tired of people saying that if you get Botox and filler, you will look older. Which, before I had not done any Botox and filler, but I take that back. I did a little bit of Botox in my forehead. That is all. I have over 6 syringes in my face. I've done multiple laser treatments. I've done sculpture in my face, and I'm gonna be honest, I think I look older there than I do right now. And on a side note, that eyebrow blindness thing is real.
Some risks also include blood vessels blockage. They are rare but serious complications that requires urgent medical attention. So always research your provider, ask about your qualifications and experiences, and make sure they have plans to manage complications. Make sure you always do your research. This video is for educational purposes only, and it's not intended to discourage cosmetic treatment.
I got chin filler tonight, and the only irritation that I have about it is now tonight I have to sleep on my back, and I am such a side sleeper, nothing sounds worse. Sleep on your back.
Let's go get my chin filler dissolved. I've only had it for a little bit, but it's migrated down my neck a little bit and I feel like it's blocking a lymph node. I sent it to a girl in Dallas that I know mutually through a photographer, because I did get it done in Arizona and I won't be back in Arizona for a long time. So my girl in Arizona can't fix it. She can't dissolve it or anything. So I found a girl here. We're at Modern Skin Med Spa in Frisco. My injector today is Shannon. She's amazing. I've only met her once. I've been talking with her through DMs and I was like, what do I need to do in this situation, because it's a little bit uncomfortable. So that's why I feel like it's blocking like a lymph node or something. So we're gonna get it dissolved today. I'm terrified. I've heard that it hurts so bad. Let's go. This just fell out of my purse and I'm so sad because it was brand new. okay, I have some numbing cream on. She asked, she was like, do you want to numb? And I was like, yeah. Say that it was a little discolored, so that means there's like a blockage, so. But she did say that it's like responding and changing color, so that means it's a partial blockage. I'm so nervous. Okay, so I thought that was gonna be a lot worse than it was. Did like a spot dissolving and kind of massaged down right here, so the little spot that was like a little bit of filler was kind of causing a little occlusion, like a partial occlusion is what she said. Got it all done. She put numbing cream on me. If I were to rate the pain of it, I would say it's like a 2 or 3. It was not bad at all. I don't know how it would be with no numbing, so I would not recommend that. But she only did like a topical numbing. Like that was not bad at all because it was on my neck right here and not my lips. I couldn't even imagine my lips, but I felt the burning a tiny bit. Wasn't horrible. It feels like less than a numbing shot, and those things hurt like a motherfucker. So we're all dissolved. She didn't dissolve the whole chin, so I still have my chin filler a little bit like right here, but that one spot is on its way out. Also, my girl in Arizona that did the filler covered the cost of the dissolving, which is so nice of her.
The goal is to help you make informed decisions and understand both the benefits and the risks before undergoing any procedure. So please always do research, make sure your body is safe, and this injection in the face, you better be careful.
I just pulled up to the office to get my filler dissolved. Tell me why I'm nervous to go in there and tell her that I don't like it. Why am I like this? I'm like scared I'm gonna hurt her feelings. I just don't like it. And I feel like weird about even saying that I don't like it. Whenever I was like talking about it to my mentor, I was like going over what I was going to say to her in the beginning when I first reached out to her, and I was like, maybe I should wait until 5:30 to text her because like I don't want to ruin her day and like hurt her feelings and telling her that I don't like it. And my mentor was like, girl, just text her. Like, you can do hard things. I know I can do hard things. It's just like the people pleasing, I guess, in my mind is like out of control sometimes. So I'm gonna be a big girl. I'm gonna advocate for myself. I'm gonna say that I don't like it. I want it dissolved. And I think my lips actually need to be evened out a little bit too. So I'm gonna go in and I will update y'all on how it looks after.
Ladies and gentlemen, stop injecting yourself. Stop following trends. Stop following everybody. Stop following the Gen Z. Stop. Let's normalize natural beauty.
Okay, it'll stay put. I got chin filler recently and she slipped away. I'll never do it again.
Really?
It was the first time getting chin filler. Okay, so I got it in this part of my jaw.
Okay.
And I used to be able to feel it like a little invisible worm, a little friend of mine.
And now it's gone.
And I used to feel her every day and I'd say thank you for the symmetry. And like 2 days ago, she's gone.
Have you gone to Diamond?
No.
You gotta go to Diamond.
Okay, it'll stay put.
Okay, you guys, I got back from my honeymoon 2 days ago, and I got to work and I was like, oh my gosh, why does my chin look insane? Right now it looks crazier, and we'll get to that, but got to work and I was like, there is a literal cliff under my chin of filler. Like, I can feel the ball. Let me just tell you guys, public service announcement, if you have chin filler, do not get those airplane pillows that you see on like Amazon or on planes where you like put your face in it and like your hands can go in there too. I'll insert a photo so you know what I'm talking about, but do not get one of those because I looked great before my honeymoon. Then when I got back, I was like, I look insane, something's wrong with my chin. It's because I had my face in that freaking blow up pillow for like collectively 20 hours. And I slept like a baby on the plane, I will not lie. But I ruined my freaking chin filler, so I don't love that for me. And I just had to get it dissolved by my amazing, loving boss because she was like, you can't walk around like this. And who was I to complain? Look at my chin. This is just swelling from the dissolver, but let this be a warning sign to any of you with chin filler. Do not get one of those pillows. It's very comfortable. You can sleep very well on a plane, but it's not worth it because dissolver is not very fun. Anyways, that's a little something about me today.
Remember, a beautiful result starts with a safe decision, right? Never let social media trends or discounted prices put your health at risk. Cheap things doesn't last, right? And make sure you are safe out there. Yeah, don't follow trend because a lot of people want chin filler. Oh, my chin is too short. It gives me a bad face, and if I, so please make sure you do your research very well. Yes, chin fillers are good, are beautiful, but make sure you do it with the right person and the right doctor.
A little cute. The fixing on propaganda I will never fall for is chin filler. When did we get into chin filler? Like, that is one thing that doesn't make sense to me. Like, lip filler, cool. The fixing on the eyes, cool, but chin filler? I don't get it. I think having Loki a little recessed chin's cute. It's a little cute. I don't know. It's just not tea to me. It's propaganda.
Hey guys, if you're new here, please can you subscribe to my YouTube channel so you always get notified when I post a new video. Chin filler is the topic of today, and boom, yeah, it is chin filler.
Okay, I need my injector friends to help me out on TikTok. So I have chin filler, and I got my last chin filler session was probably 2 years ago, maybe a year and a half ago, and this is the first time this has ever happened. I'm sick, obviously, and my chin filler and my whole chin is sore. It's so sore to the touch, which is so weird. When I used to have lip filler, when I feel when I would get sick or if I was inflamed, my lips would get super swollen. They were never sore. So I'm just why is this happening? Why is my chin sore?
This is just a PSA. If you are thinking about getting filler, face filler, or even if you already have face filler, did you know that it doesn't matter how old the filler is? It could be a week old, a month old, even a year old. Your face can still have a reaction and can reject the filler at any time, because I didn't know that. And now I am dealing with this. Anyways, that's long story short. I haven't been around this.
About my chin filler horror story. Oh my god, every time I wear white, I did not talk about this for the longest time because I was just so scared to talk about it, because this was genuinely one of my first experience of ever getting anything done on my face. Getting a chin filler was a huge deal for me. Forget about injectables, I never even did anything like an invasive or intensive facial on my face. Also, this was before Korea where I got all those lasers done, so I was genuinely a newbie to this world. Let's get into the story and the backstory of it. The reason I want to make this video today is because there's this really disturbing video that popped up on my TikTok of fillers and Botox party where this doctor is sitting and just giving fillers and Botox to people one by one, and I swear to God, I was fuming, because if you're touching your face or any part of your body or anything at all, you need to be so careful, and there could be so many consequences like the one that I experienced. It's what my face looked like before the chin filler. Honestly, I never really thought there was anything wrong with my face. I loved the way I look. Just was okay, you know what, what's the harm in trying it out? It's just a little bit of a chin filler, and it's usually considered one of the most safest fillers.
He told me that I had a weak chin. So you put the tip of your index finger at the tip of your nose, you let it rest there. And if your chin is not touching your hand at the bottom, then that means you have a weak chin. And that's kind of how you get a full, even face structure. This fucked me up, okay? I'm not kidding. I left that office, I was screw the buccal fat. All I can think about is my chin. I've always had an issue with my profile. Whenever I've seen a photo of myself and you could see the side of my face, it drove me nuts. Something about my face. His recommendation for me was that I try doing a little bit of filler in my chin to bulge it out a little more so that it would be more in line with the tip of my nose. And I was okay, that's something I'm going to think about. That's just something that would be pretty instant of a fix that might boost some of my confidence.
Hey folks, please kindly subscribe to my YouTube channel so you always get interesting content, interesting videos about surgery, cosmetic, beauty, oral care, and a lot more. So today is about chin filler. If you have anything to say concerning this, you can kindly drop your comments in the...
Do you know that chin filler can cause necrosis in the lower lip or even inside of the mouth? This means when performing chin filler, you must also look out for blanching in both of these areas. And it's because of this artery here, which is called the mental artery, and it can run through the chin, through the bottom lip, and also inside of the mouth. We never know how deep or superficial this artery runs, so that's why we always use the down to the bone bolus method.
Because that's day 3 of getting chin fillers, and the update is that I can speak freely now. Yesterday, I can speak a lot better compared to the first day, of course, but at this time I can smile, I can laugh. Well, I just laugh, literally. I can eat. Doesn't matter if it's soft or hard, but I have much more autonomy now. But when I do my skincare, I just have to make sure that on the chin area should be gentle, and yeah, it looks so much better now. I don't know if after 3 weeks it's gonna look so much better. I mean, it should, because that's the expected timeline of when we can see the full effectivity of the fillers, but my doctor told me that we need more because there was an allowance left. There was a space left. We'll see on the last week of February.
Oh my god, what is this? What is this? Guys, what is this? Oh my god, why are people going through this kind of pain? Why can't you just accept? Why are we not normalizing our natural beauty? Why not? Why was this is terrifying? Oh my god, I can't believe this is done in human, breathing, still alive. I mean, just imagine what was done in her chin. Like, what is this? Why? Like, why are we doing so much just to keep in? What is all this? What does it even gain?
It's finally day 5 after my double chin procedure, so that means I can now take off this head garment and I don't have to wear it anymore during the day, only at night time for the next 2 weeks. So let's take it off and see what we're working with. I warn you, it still looks absolutely fucking mental. Like, this is the most swollen it's been so far because it keeps getting worse for 5 days. And then after today, it's going to get better quickly, apparently. So let's take it off. This is the most bruised and swollen my neck has looked the whole time. Like, it is literally bright yellow. A lot of people after this procedure say that they get a wonky smile, and I haven't got that, but I have got a wonky pout. Look, like when I pout, it goes to the side. What the fuck? It's like where the nerves have been like traumatized and they need to heal themselves. It is supposed to go back to normal in the next like 3 weeks. So I'm also allowed to take off these little plasters. This is where the surgeon made the incision, so hopefully it's healed up because I don't want it to get infected. Oh, I'm scared. It's fine. That's where the big metal rod went in. Two over here as well. Ooh. You know how everyone's saying that Kylie Jenner got a facelift because she's got like a little scar there? Maybe she just got this procedure. I don't know what's worse, wearing the chin strap or walking around looking like this. Honestly, it doesn't look as bad as yesterday. Like, I literally look like Jabba the Hutt. This is it from the side, but right now, as you can see, my double chin is quite literally bigger than ever. So obviously we'll have to stay tuned over the next 3 weeks because there's going to be an improvement in the swelling, and then from 3 weeks to 8 weeks, that's when 70% of the results are going to be showing. That's when I'm going to start looking snatched, and then apparently the skin just keeps tightening up to 6 months, so that's when we'll see like the end result.
So this is a great example of why we can't give medical advice over the internet, because it really requires an in-person assessment. Hi, my name is Van, Bay Area Aesthetic Injector, and I will try my best to give her some insight, but because I am not able to see her in person, we can't really say exactly what's going on. She got chin filler 2 mLs gradually over time, and then it camouflaged her cleft chin. She liked it, and then recently she got some Botox in her chin and then realized now it's dimpled again, and she's wondering what's going on. Generally speaking, filler is pretty stable for at least a year, oftentimes longer, depending on how much you put. And so I'm thinking the cleft that she now has is not a result of the filler. Most likely it has to do with the Botox injection. Pimentalis is the muscle in the chin that lets you do that, and it's a 2 belly muscles, so a left side and a right side. So if you don't really get both sides equally, you can have an asymmetric contraction. It can look kind of funny. So yes, I would follow up with your injector and have her take a look, do an assessment, and see what's going on.
Everything that I've done to my things that I would never. So you've had everything that I've done to my face, but here are the 5 things that I would never do again if I had to start all over. I'm going to be honest, if I had to start all over again, I would get less filler. I don't think I look crazy. But some of the syringes of filler that I've had along the years were just unnecessary. I would have definitely leaned into biostimulators like Sculpture way earlier. Number 2, jawline filler. There was a trend once upon a time of putting mills and mills and mills of filler in one's jawline. However, I just feel like it looks bulky, masculine, aggressive in women. I don't know why we did that. I don't know why we did that. Instead, what I wish I really leaned into earlier are energy-based treatments like Ulthera, because that thing is going to leave that jawline submental area snatched. Number 3, Profilo. I'm going to hurt your feelings. I know a lot of you swear by it, but Profilo, I saw no difference whatsoever. And I had it done to my face and my hands. And in my point of view, unless you have mature skin or very, very dry skin, I don't think you're going to see much of a difference. I've really been leaning into lasers of late, but Moxie laser, is that my skin kind of look glowy, I guess. And instead of Moxie, I've been loving lasers like Clear and Brilliant. And last but not least, if I had to start all over again, I would use hydroquinone sparingly. At the beginning of my serious skincare journey, I would definitely say that I had a bit of a codependence on hydroquinone. And I don't blame myself because it bloody works. It's amazing. That ish can work within a week. However, a lot of people don't know how to use it properly. And if you're not careful, you're going to be looking translucent. You're going to be looking lifeless. There's a particular hydroquinone look when you've been overdosing on it. Instead, I lean into things more like arbutin, kojic acid, azelaic acid.
It's been 6 months since I got my chin done, so without further ado, I think it's high time we do a full chinny chin chin update. For those of you who don't know, I had a recessed chin and I didn't like it, so I chose to get a chin implant and I could not be happier. Since getting my chin done, I feel like I have watched my face shape change almost every single day. So the first few months, I noticed that my face was so stiff. Even when I go back and watch old videos, I feel like I was talking like this after I got my chin implant installed because it was so tight and it took so long for my whole face to get used to having this silicone thing stuck to the bottom of my face. Now that we're 6 months out, I feel like this is the end result and I'm loving it. I'm loving the way it looks. Also, I have noticed that I have always had a very full face, but since getting an implant, I've noticed that like my face shape has slimmed out and I think it's given me a very pretty effect. Not that I didn't think I was pretty before, but I think a prettier effect. Like I now have these like little cheekbones.
What is this? What is she doing? What is she doing? Oh my.
No, I'm so sorry you're dealing with this. Mine also has not changed at all. Like I can't feel any improvement really. My doctor did say to like tap as if you're like typing on a keyboard, kind of just like tap through that area to help with the nerve regeneration. I have been reading online that nerves grow an inch a month, and my doctor said that at the 4-week point I should start to have some feeling, so hopefully once you hit 4 weeks you will start to get that feeling back. Let me know. I'm sorry you're going through this. I totally know exactly how you're feeling.
I'm 10 days post-op today and am starting to regain strength in my facial muscles. There's still some weakness on the left side, which is why my smile is lopsided. I also have significant numbness and occasional tingling in my face due to temporary nerve damage, which is normal for the surgery I had because the facial nerves run through the surgical zone. My mom made me pumpkin soup and steamed egg for lunch. It was so delicious.
It's a great question. Can filler that is placed at the chin or in the jaw redistribute and potentially give you a double chin? I've actually seen this many times. And where I think this is going wrong, this is not just random migration that's just happening, but what I think is going wrong is that people that are injecting are not on the anterior portion of this lower mandible, but they instead think if they can come underneath and give extension or length to the chin, that's a better option for their injection point. But what can happen is if you do come too far inferiorly, you can have that redistribution along that smaz layer of that filler, and then you can end up having a fullness or a puff under here. to stay safer, we've actually been mapping the face for redistribution for both the benefit and the detriment of what redistribution can do. And if you inject underneath that fat pad in the chin, the product will actually stay put. Part of our responsibility as injectors is to know where to inject to keep our patients safe, but also for the best outcome that is going to maintain its results over time.
I got filler in my nose, my lips, and my chin. I did what they call a facial balancing, and I'm gonna post the before and afters. This is the before. Look at my nose, look at the hook, the crook, look at my chin. It's so weak, it's recessed, it's not there. Even my lips, my bottom lip was good, my top lip was not good. Look at that. That is just filler. My nose looks more straight, my chin comes out more, my lips are more full. This is another before and after. I hated my nose. I hated it. I felt like a bird. I didn't want to smile. And now I love it. My side profile is my favorite thing. Like, can we just take a moment to appreciate the difference of this side profile?
A bunch of my filler the other day, and let me tell you why. Okay, so starting off, I got a bunch of my nose filler dissolved. She mainly placed the nose dissolvant here, but basically if you have nose filler and you think your nose is getting wider, go and get your nose bridge dissolved, because it is the filler migrating. I promise you. I think the nose filler migrates like 70% of the time, so yeah, you need to get that stuff dissolved regularly. Second, okay, I have not gotten lip filler in literally years, but I noticed I still had a little bit in my upper lip, mainly on the bottom part here. And the thing about having a bunch of filler on the bottom part of your upper lip is that it'll drag your face down. It'll elongate the middle of your face and make your fill trim look longer, and that is just personally not the look that I'm going for. So I did get that dissolved, and I honestly feel like my lips look way better now. I also get a lot of hate for people thinking my lips look extremely fake, so that was a little bit of a motivation, but it was mainly for myself. And lastly, I got my chin filler dissolved, which is something that I never thought I would ever do, because if you know, when I first got my chin filler done, I was like, I'm getting a chin implant, like I need this forever. But I kind of just got over the look of a super sharp chin, because that's what I used to go for. I wanted a super sharp snatched chin. I feel like now I'm leaning more towards a softer look, so I don't really want my chin to be so sharp anymore. I wanted to go back a little bit more to my natural rounded chin shape, and I also feel like it did elongate my face a little more than I wanted it to. And now that a lot of the chin filler is gone, I feel like my face has gotten a lot shorter and more natural looking.
Ladies, let's talk. Is it possible we normalize accepting our natural beauty, like the way God created us? Like, is it actually possible in this Gen Z generation, or they call it Gen X or Gen Z? I mean, the pressure on social media is too much. People are chasing cloud. People are doing trains. People are going to train every day.
I'm so glad that someone actually asked me this question. So no, I'm not fully healed yet. The healing process takes around 3 months, and today is only day number 58, so I'm only 2/3 of the recovery journey. I did intraoral incisions. I had one incision here for the jaw, another incision here for the jaw, and the last one here for the chin. And as you can imagine, they need to put the incision right below the lip area in order to stuff the incision and attach it to the chin area. Being in such close proximity to the lip makes it very natural and expected that there will be some form of tightness and discomfort as well as swelling in that area, because it's so close to the lip, right? And my chin was so small originally, which is why I got the implant. So if you have any questions about the surgery, feel free to ask me in the comment section here, and I'll be happy to answer you.
So I had so much fun making my video yesterday that I decided I'm gonna pop on here and tell you guys a crazy story of something that's happened in my life. And gather round, children, this is a good one. So right after my divorce, I had breast implants done because I had nursed 6 children. And it was such an easy surgery that I asked the surgeon after, like, what else would you do to me? And we decided that I would get a chin implant. I no longer have it. This is filler, but I do have like a weak chin by nature. And I decided to do it, but I knew I would be judged because it was literally right after my divorce. So I didn't tell a soul. I paid an Uber driver to sit with me at the surgery center and pretend to be my friend who took me home. And the only person I told was this guy that I went on one date with. It was our very first date. It was my first date after my divorce. I don't know why I told him, but the day after I had my implant done, I caked on makeup, which you're obviously not supposed to do. And then I proceeded to tell him during dinner that I had a new chin. So wait, it gets better. Then I go home that night and my face starts swelling. I'm like, something's wrong. But mind you, I haven't told a soul, and I'm a single mom with 4 little kids at home. So the next thing I know, it starts spreading down to my neck, and I FaceTime my friend Leah, who's a surgeon, and I was like, you know, should I be worried? And she was like, yeah, you need to go to the hospital right now. So I go and bang on my neighbor's door. It's like 11:30 midnight at this point, and thank God she wakes up, and I'm like, can you please just come sleep at my house with my kids? Because I have to go to the hospital. And she's like, yeah, obviously. So I go to the hospital, I go to the ER, they pump me full of like Dilaudid and all these other drugs. And the next thing I know, it's like 5 in the morning, and they're like, we've spoken to your surgeon. He's going to meet you at the surgery center. You need to have someone drive you. I'm like, just let me call an Uber. And they're like, no. Like, we need to see someone that is with you that will take care of you, or we can't release you. So I called the guy I went on the date with at 5 in the morning. The poor guy answers, comes to the hospital. I mean, I look like hell. He drives me to the surgery center. He goes back with me, holds my hand while they cut open my face while I'm still awake. And they pull out this implant and like pus, and it was just disgusting and horrible. And then I convinced the guy to pick up some donuts on the way home and drop me home with my kids. So don't mess with your face, children. It's not worth it.
This is a migrated chin filler, over-injected, or it's just injected into the muscle. It's important to know how much to inject in what depth of the chin so this doesn't happen to you.
Is here. Can chin filler migrate? Technically, all filler can migrate, but I don't want that to scare you. Let's dive in. Let's talk a little deeper about why this is less of a concern like it is with lips, and let's talk chin. So differences in injection technique can change per everybody, but keep this in mind. When you go down to chin, most people go down to periosteum, which is this layer of the skin right before the bone. We just call it bone. It's better on the patient to hear periosteum rather than I'm going down to your bone with a needle. So keep that in mind. It's a very deep injection point. Now periosteum is here, right? Here's a great, you can see above the bone and then periosteum deep fascia. So keep that in mind. We're going all the way down there. We are under the muscle. This is for your chin filler. Let's also take a look at another aspect of anatomy, and that is the muscles. So your mentalis muscle is the culprit when it would come to filler migration here. This is a really good highlight of the mentalis muscle and how it bifurcates. But let's get into lips, okay? So lips, you can see that this muscle is a sphincter muscle, just like your butthole, just like your eyes. Now what we are trying to do is make your lips look beautiful, right? We are not going down to periosteum with lip filler. You are actually more superficial. We'll leave it up to the professionals that know anatomy way better than I do. And they did a study, Codafana, one of the very well-known anatomists in aesthetic medicine, and he averaged out how deep the inferior and superior labial arteries are, and he got 5.6 millimeters. So we want to stay above that, right? For safety reasons, but also think about how superficial you are in comparison to going down to periosteum. And with how active that muscle is, migration is so much more common in the lip. Chin, on the other hand, with toxing the mentalis and not using it as much, it's way less common, and also you are going down to periosteum underneath the muscle.
Your chin is recessed. That means your maxilla is recessed. That's not good.
I'm Dr. Just, a board-certified orthodontist, and I did my master's thesis in cranial growth and development, and let me explain why this is not true at all. This is one of the figures from my research, and what it is a tracing of a cephalometric x-ray, and from there we can take all sorts of measurements and make relationships to the upper and lower jaws. I specifically was looking at how the cranial base angle determines where the jaw is positioned in relation to the upper and lower jaws. This has been shown in research that the maxillary jaw, which is the upper jaw, is connected to the anterior cranial base, while the lower jaw, which is the mandible, is hooked up to the posterior cranial base. As the cranial base angle changes, this can determine where your jaw is positioned in relationship to the upper jaw. So yes, it is possible that your upper jaw is in a good position and that your mandible is just set back a little bit lower, and that could be because of how your cranial base is formed.
I'm going to be explaining why some people find chin filler extremely painful post-treatment. This is typically aimed at the people that get around 1 mil of filler in the chin in one sitting, but this can also happen to people that get 0.3, 0.4, 0.5. It just doesn't happen as much. To be honest, it all really comes down to the amount of space you have in your chin before we put filler in there, but I'm going to be explaining everything. The kind of feeling that you might get post chin filler is quite literally that somebody's punched you in the chin, and a lot of people will message me saying, is this normal? When will it go away? What can I take to help it? Why does it feel like this? So on our chin, we have the mentalis muscle, which sits above the bone. It's relatively superficial. Some people have a really strong mentalis muscle, and when they do, you can typically see their chin move quite a lot when they speak. They might have a sort of orange peel kind of look of a chin, where it's like dimpled, which you can actually relax with Botox. But when you have a strong mentalis muscle, and then you put down the filler underneath it, which sits on top of the bone, when you put the filler in there, and say if you put a whole mil in there, that filler will push that mentalis muscle quite a lot more forward. So obviously you will get the projection from the filler, but you will also get some of the projection because of the muscle being pushed forward as well. If a muscle is affected in any kind of way, for example being pushed or sort of pulled away, of course it's going to hurt. And this doesn't happen as much in like cheeks, chin, jaw, because the mentalis muscle is such a strong muscle. Another reason why it will hurt more than other areas of the face that we inject filler in would be because the chin obviously moves like all the time. You can't speak without moving your chin, you can't smile without moving your chin. Even doing that may hurt post chin filler treatment. The reason why getting dermal filler in other areas of the face might not hurt as much is because you're not affecting the muscle as much as what you would be by injecting chin filler. There's also loads of nerves all around here and under your neck, so you are guaranteed to get some level of pain post chin filler. To me, it's not enough to put me off because I've had it done 3 times now, and none of my clients that have had chin filler by me before have said they would never get it done again. But it is something to be aware of if you know that you can sort of worry quite a bit. Another thing is when you have a lot of pain in an area, you most likely will have a lot of swelling as well. So sometimes your chin will actually get quite a lot bigger in the process of healing after you've had chin filler, which can worry some people because they think, oh my god, is that going to be the final result? It's not. Some things you can take to help will be antihistamines, cold pack, drink plenty of water. This might not work on everyone though, so you do kind of just have to wait it out. This is why I don't tend to inject more than 1 mil at a time in the chin unless I was to use a cannula as opposed to needle. With a needle, if you're going like pretty much straight in the middle and you're looking for projection, I just think it's way better to build it up over a bit of time, because when you do 1 mil, you're then pushing it forward and you know the muscle is learning to deal with that filler underneath. But if you're to do double that, then the muscle's going to be even more like stretched and pulled, which you could just avoid that if you let it settle by doing 1 mil first, waiting 3 months plus, doing it again. It will be the better route forward and you'll probably get a better outcome as well. I hope that helps. If you are thinking of getting dermal filler in the chin, or if you've had it and you wondered why it hurts so much, If you have any questions about this treatment, put a message or a comment on this post.